today, let's talk and treat total hip replacement or total hip arthroplasty. So you finally decided that you need to have your hip replaced because you're having pain, it's limiting your function, you're having to use an assistive device now. So you've decided to have your hip replaced. So following having your total hip replacement, it's very beneficial to have physical therapy come into your home. We can take a look at that hip, make sure there is not any infection starting. In addition, we can help you with your exercises, help you with negotiating steps. Sometimes you have 4 steps to get into your home. You have a doctor's appointment coming up. So we can come in and help you with that, in addition to do a home safety evaluation. Check for throw rugs, check for anything that might cause you to trip and fall, be a safety risk. Also, to make sure that your medication is taking care of your pain, because you're not going to be completely pain-free, but we want that medication to help you so that you can do your exercises properly. It's not going to limit you, so it helps you make it through that initial time period. In addition, it allows you to get your proper sleep at night, because if you don't, if you wake up in pain, you're not hitting that rapid eye movement. And rapid eye movement is when you are sleeping and your body is repairing itself. So this is extremely important for healing up that incision. Also, proper nutrition is important. You eat your fruits and vegetables to take in your vitamins. You can also take a supplemental vitamin, and also lean protein. So egg whites are your purest form of protein that aids in the healing of that hip. You're also going to want to make sure that you ice it, and especially after you exercise, you ice that hip down a good 15 minutes or so. And elevating up above the heart is extremely important. So you can lie down on a pillow and then you elevate that leg up above the heart so that you get a little bit of decreased swelling in that hip. And a lot of times with a hip replacement, you have the swelling not only in that hip, but it'll travel down the leg. That bruising will travel down the leg. So very good to elevate. So the following exercises that I'm going to provide you with are the exercises to be done 4 to 6 weeks prior to surgery, so you can prepare for your surgery, and the exercises that are going to be done immediately following your surgery. So the day that you have your surgery done, if it's early, that evening, you should be doing these following exercises. So the first exercise for a total hip replacement, I would start out with ankle pumps, 30 repetitions. If you have to stop earlier, that's fine, but you want to build up to 30. That's my magic number. It really helps people become more functional, and this is increasing your circulation, so you help to prevent blood clots. Another exercise is heel slide. So you just slide up and slide out, slide up and slide out. Not too much hip flexion. So they do things differently now, but a lot of times you have 3 precautions. So you don't want this knee coming up higher than that hip. So 90 degrees straight out is one of the precautions. You do not want to cross your legs. Crossing your legs is a no-no. In addition, internally rotating. So you see my foot, if I turn that toe in, that's not something that we want to do immediately after having our hip replaced. So another exercise would be a terminal knee extension. So you place a pillow, or I have my little ball here today, and I push the back of my knee down. This is about 15 degrees of knee flexion, and I just lift that heel up. And this is strengthening my inner quad muscle. And this is also preparing you for your surgery. Your muscles have memory, So if you can train your muscles before your surgery, after your surgery, it's gonna be so much easier, so much easier. Also, we do hip abduction. So my leg is out straight, I slide it to the side and bring it back. You also have the option, if you wanted to do both feet, you could do what we say, snow angel. Slide both feet out and together, both feet out and together. So the straight leg raises, they normally like to wait on after a total hip replacement. We would get you into some standing exercises, but these are the ones to start out with, and these are the ones prior to your surgery and following your surgery that are very beneficial. In addition, you might have trouble getting your leg up and into bed. You might be provided an assistive device, just a little strap that you can put over your foot. If you don't have that, you can just take a towel, or you can take a sheet or a pillowcase, and you can use that, straighten out that knee, and you can lift to get it up into your bed. And the same thing, you take it off, you're in bed, you toss it over that toe, and you can use that to lower down out of bed. This makes it a lot easier. You can also use your good leg by placing it underneath, and you lean back, get that leg up into your bed, and again, underneath, and lifting it down out of bed. It normally takes a week or so until you can really start increasing that function and be able to get that leg up and down in your bed. A lot of my clients will even maybe sit elevated in their recliner, and that's the most comfortable place for them to sleep for a little while. But whatever's good for you, just make sure that you talk with your doctor or your nurse or your physical therapist about any uncontrolled pain, because that's very important. We want to get rid of that pain. We want to increase those exercises, increase that activity, improve your function, and get you back to where you were before you started having that arthritis pain. A lot of people ask me, how long does it take? Well, you might be on an assistive device for anywhere from 4 to 8 weeks, depending on how you're doing. And for full recovery to take place, it does take normally 6 to 12 months. Hopefully this gives you a little bit of a head start. Have a great day.